Hi everyone, my name is Supriya Iyer and I am a medical student at Oregon Health and Sciences University. And today I'm going to tell you about our methodology for creating an ultra low cost kidney phantom to simulate PCNL access. Here are our disclosures. So why do we do this project? Well, PCNL, or percutaneous nephrolithotomy, is the standard of care for large and or complex kidney stone removal. Percutaneous renal access itself is a complex and potentially life-saving procedure, and although often performed by interventional radiologists, there has been an increase in the number of urologists trying to gain access on their own for percutaneous nephrolithotomy. Using ultrasound guidance for percutaneous renal access reduces dependence on interventional radiology or fluoroscopy, but while the skill requires hands-on training, simulation models can be prohibitively expensive and difficult to obtain. So we're going to demonstrate a method for you today to create a do-it-yourself kidney phantom using household products and items commonly found in hospitals as a method of on-demand, low-cost simulation. And we'll then assess the usefulness of these phantoms in hands-on simulation courses. So our goal is to create a kidney model that simulates renal architecture. It doesn't have to be perfect, just good enough. We want to use ultra low cost, reusable, and easily available materials, and our model should look similar to a kidney under ultrasound, feel similar to a kidney during needle placement, and facilitate skills transfer with the PCNL procedure. So now I'm going to show you how to make your own PCNL kidney phantom. First, gather your ingredients as shown. All materials are available at hospitals, hardware stores, or grocery stores. To make our peripelvic fat, mix together room temperature water and gelatin in 2 or 3 portions, making sure to mix between each addition of gelatin. Once you've fully incorporated the gelatin, let the mixture sit at room temperature or in the fridge to bloom, which is a process in which the gelatin fully absorbs the water. After about 5 to 10 minutes, the mixture should be a homogeneous color with a rubbery texture. In the meantime, prepare your renal calyces. Gather a single surgical glove, some suture material, and a Foley catheter. Use the sutures to tie off the fingers of the glove a little more than halfway from the tips of each finger. Trim the suture ends, and leave the thumb intact as it will be removed later. Once each finger has been tied off, cut off the finger just distal to the suture. Next, insert the Foley catheter into the wrist portion of the glove until it is past the thumb. Tie off the wrist just distal to the thumb around the glove with the catheter inside. Use 2 pieces of suture to ensure that there's no leakage once we inflate the glove with water. Now you can go ahead and cut off the excess glove material, including the thumb. Inject water into the glove via the catheter until the glove is plump. You have now made your renal calyces. Set this aside. Your gelatin should be fully bloomed by now. Pour this mixture into a bowl and set that bowl over a pot of water to create a double boiler. Heat the double boiler over gentle heat until the gelatin is fully melted. Once the gelatin is cool to the touch, take a 1/4 cup of the melted gelatin and add 1/8 of a teaspoon of psyllium husk powder. It is important that the gelatin be cool to the touch before adding the psyllium husk, because if it is too warm, the psyllium husk will fall to the bottom of the mixture, and if it is too cold, the psyllium husk will not mix well. Pour this mixture into the corner of the zipper lock bag. Lower the prepared glove, still with the catheter and syringe attached, into the zipper lock bag corner. Use a binder clip to secure this to the edge of your 2-liter container, which will allow the gelatin to set around the glove, similar to how peripelvic fat appears on ultrasound. Place this into the fridge for an hour to set. Once set, remove from the fridge. Take the model out of the zipperlock bag, get a new zipperlock bag, and tape the corner, like so. Take 1 cup of your melted gelatin and add 1/8 teaspoon of psyllium husk and mix. Place the renal calyx plus the peripelvic fat into the taped zipperlock bag. Pour the gelatin mixture you just made into the taped zipperlock bag around the renal calyces plus the peripelvic fat. Suspend this from the side of the 2-liter container as you did previously, and place in the fridge for another hour to set. Once set, remove your kidney model from the fridge. As a reminder, this is now the renal pelvis plus the perirenal fat plus the renal parenchyma. Remove from the zipperlock bag and trim with a knife to remove any sharp corners and to approximate about 1 centimeter of renal parenchyma surrounding the perirenal fat layer. Place this fingers up in your 2-liter container and set aside. Now we are going to make our ultrasound gel slurry, which is for our abdominal tissue. Heat water to 65 degrees centigrade. Mix water and ultrasound gel slowly to avoid incorporating bubbles. Over the course of a few minutes, the slurry should change from mostly liquid to a texture that holds its shape when you remove the spatula. Wait several minutes until the ultrasound gel slurry is cool to the touch. If you pour the warm gel over the kidney model, it will melt the gelatin, so we want to wait for that gel slurry to cool. Pour the cooled ultrasound gel slurry into the 2-liter canister with the model kidney already inside it. Make 1 more batch of this 1-liter ultrasound gel slurry and pour this into our 2-liter container until the 2-liter container is full. Please note, in this model we have a few too many bubbles. Try to mix and pour your ultrasound gel a little slower than we have in order to avoid these bubbles, which can interfere with ultrasound imaging. We're almost there. Now take the silicone mat and trim it so that it is a few centimeters larger than the opening of your 2-liter container. Using a cable tie, secure the silicone mat around the container opening until the mat is taut. Make sure that the catheter is secured under the head of the cable tie. This helps the silicone mat lay flatter. And now we're finished. You can use an ultrasound probe on the silicone mat with a bit of ultrasound gel as you normally would. Practice aiming for the renal calyces using a long needle, such as a spinal needle, as shown here. Here is a video of us practicing PCNL access on our model. Note the tactile feedback when entering the kidney parenchyma and a popping sensation when entering the renal pelvis. Water flows out of the needle with trocar removal, confirming correct placement of the needle. Also note that the ultrasound gel slurry prevents needle tract artifacts and increases reusability. This model is partially reusable as the ultrasound gel slurry does not hold the needle tracks. You can remove the kidney portion and place a new one into the abdominal tissue. To test our models, we've held a few courses around the world in the last couple of years. During each course, participants were given 1 hour of instructional lectures. Participants then used handheld portable point-of-care ultrasounds to identify targets within the phantoms and demonstrate proper needle maneuvering techniques to reach the target, with water efflux from the needle indicating successful entry. Pre- and post surveys were given to assess participant experiences of the course. Our results have showed that for about $7 of disposable cost per model, we can create these do-it-yourself kidney phantoms at home kitchens close to the course locations themselves. In the past few years, we've had 40 participants in our courses, 63% of whom were attending physicians. 53% of these participants reported being either very or somewhat comfortable with ultrasound-guided needle placement prior to the course. But after the course, 100% of participants reported improved comfort in performing ultrasound-guided nephrostomy tube placement. 94% of participants reported that the phantom adequately simulated renal anatomy, and 97% of participants reported that the phantom is useful for training purposes. And overall, 100% of participants would recommend the course to a colleague. Here are images of our results. On the left, we have an ultrasound image of an in vivo kidney, while on the right, we have an ultrasound image of our low-cost kidney phantom. Here's a comparison of the renal collecting systems, the renal parenchyma, and the abdominal tissue. So, in conclusion, we built and deployed ultra-low-cost kidney models. We facilitated a few simulation workshops in both high and low-income settings, and overall, 100% of participants judged the courses to be useful in training and increasing comfort in the procedure. Thank you very much.